I'm Dr. C Gupta, heading the Department of Vascular and Endovascular Surgery, Interventional Radiology and Podiatric Surgery at Care Hospital in Banjara Hills. It's a very unique combination of specialists that we have to provide comprehensive care to vascular patients in one single department. With me today is Dr. Radhika, who is trained in plastic surgery and also then trained in podiatric surgery. I think one of the best combinations we can have to manage patients who have foot problem with diabetes. So Dr. Radhika, you've been working with us for quite some time now and managing our patients with diabetic foot. So we've seen that diabetes affects many organs, from head to toe, whether it's the eyes, the carotids, which can cause stroke, the kidneys, the heart. What is so special about feet? Why do we talk about diabetic foot?
Yes. Why do we talk about diabetic foot is when patients develop ulcers in their feet, it sometimes can lead to major devastating complications like losing their limb or life. And patients don't know why it is happening and when it is happening. It can happen over a time and it can even be sudden. So that is why taking care of the feet becomes very important in patients with diabetes.
So what are the early signs or indications that patients can watch out for that might indicate that they are going into foot problems?
Yes, any patient with diabetes should take care of their feet even without having any wound or any problem in their feet. But when you are looking at your feet, what you should look for is any redness in your feet, swelling in your feet, change in color of your toes or nails, and the warmth or the temperature of the foot. If the foot is becoming warm or cold, all this indicates there is a problem which is going to happen in your foot.
So we quite often see that patients who have minor cuts, minor injuries, somebody has an ingrown toenail, they undergo a surgery. A lot of them end up with major problems. Another thing that we saw a patient in the clinic a couple of days back who had applied some heat to the heel and developed a large blister with a very deep wound. We also see patients in our clinic who have gone to the temples in summers, walked barefoot for a long time, and come back with large burns on both the soles. So why is it that even minor problems, which does not affect other people, affects people with diabetes?
Yes. What happens in people with diabetes is they don't feel the sensation in their feet. So if I walk on barefoot on a place which is hot or warm, I will feel that it is warm and I will step back. But people with diabetes, they don't feel that and they continue to walk in spite of the wounds. And their immunity capacity, infection fighting capacity is also less. So they don't fight the infection as well as we do.
Yeah. So I think it's a double problem: lack of sensation and the inability to fight infection very strongly or very aggressively. And sometimes what we see in our practice, and we'll come to that in another discussion, is patients also have decreased blood supply. Now, when you talk about no sensation, I'm reminded of a story which Dr. Armstrong, a very famous podiatric surgeon from the US, tells, is that he had a patient who complained of that while he was walking on that wooden floor, whenever he walked, he heard a noise, tuck, tuck, tuck. He stopped, the noise would stop. And he never knew what was happening. Till one day when he reached him, they found there was a nail stuck in the foot, which the patient could never feel. So that is the extent to which the sensation can be affected in a patient with diabetes. You don't feel pain or anything at all. Now, what are the important things that a patient can do or on a daily basis to prevent such complications?
Yes. In one word, if I have to put it, sir, just take care of your foot like you take care of your face.
Very nice. Take care of your feet as you would take care of your face. No blemish.
Yes. And another few simple steps is never walk barefoot. Always use appropriate footwear. When we say footwear, it is not the chappals which Hawaii chappals which people keep walking. It is the proper sandals which take care of the feet. Never use hot water or cold ice packs on your feet. Do not smoke. Keep your sugars under control. And don't cut or do the surgery at your home yourself, like cutting the corn removing the nails with sharp blades.
Yeah. So I think for all these minor things, there are people who are trained, and you must come to a podiatrist or a podiatric surgeon to get these things done instead of managing such problems at home. You spoke about footwear.
Yes.
Now, how does the right footwear help a patient with diabetes in preventing foot complications?
Yes. In patients with diabetes, what happens in foot is usually the foot shape will be deformed or different from the normal feet. Over time, because of neuropathy, which we call as motor neuropathy and autonomic neuropathy, there will be change in the shape of the feet. So normal footwear will not usually accommodate the diabetic feet. So that's where the importance of footwear comes. Even the length of the footwear becomes important. To accommodate swelling in different people with diabetes, footwear shape and size also matters a lot. And with the deformities, the footwear should be able to accommodate the deformity and distribute the pressure throughout the foot.
Yeah. So I think what we talk about when we see patients with diabetes in our clinic, one, preventive footwear. So if the feet are otherwise healthy, we advise preventive footwear to obviously prevent any problems so that they don't land up with diabetic foot ulcers.
Yes.
And then of course what Dr. Radhika told us is total contact footwear to distribute weight equally along the entire sole so that no one area is subjected to excessive pressure resulting in ulcer formation or diabetic foot. Now if you were to name one habit or one thing that patients can do to prevent such problems.
Yes. Most important thing is never walk barefoot. And one more thing I would like to add is look at your feet every day before sleeping.
Yeah. So sometimes when patients are obese, they find it difficult to look at their feet, obviously. So get your partner to do it, get somebody else at home to do it, or put a mirror opposite your sole and look in the mirror so that you're able to see your foot clearly. So to sum up, I would say early care and daily attention to your feet is what can prevent problems and long-term complications. And as Dr. Radhika very nicely said, take care of your feet as you would take care of your face. Thank you.
Thank you.